The Toronto and Canadian governments announced $7.7 million for harm reduction initiatives in the city on April 14. These three projects will increase access to safe supply programs and provide a first-of-its-kind treatment option for addictions. These projects will provide a pharmaceutical alternative to a toxic street drug supply, which is meant to prevent overdoses. Additional funding will be provided to select community health centres in Toronto to extend safer supply programs. I spoke with Paulos Gebreyesus, the Executive Director of a Regent Park Community Health Centre, to learn more.
Paulos, thank you so much for agreeing to speak with me.
My pleasure.
My first question is, why did select community health centres in Regent Park receive funding for the Safe Supply program?
All right, so maybe I'll clarify a few details there. The funding proposal was put together by three organizations in our neighborhood: the South Riverdale Community Health Center, the Regent Park Community Health Center, as well as Street Health. So the three organizations together have proposed this project to Health Canada, and we were fortunate enough to get some funding in order to implement the project.
How do you feel about your organization being provided with this funding?
Very excited that we have one additional intervention that we can offer as an option to community members that are trying to keep themselves safe.
Why is it common for areas such as Regent Park to have a large number of drug overdoses?
That's a really good question. And a lot of it has to do with how and where people who are struggling with homelessness, people who are struggling with mental illness and addictions end up finding supports and services that are geared to their needs. Because we have a significant number of emergency shelters and services in the downtown east area of Toronto, we tend to see a larger concentration of people who are finding themselves, accessing services in our neighborhoods.
What is your reaction to the fact that overdoses in Toronto increased between January 1 and November 30 last year?
So it's actually very, very distressing knowing that over the past year during the pandemic, there was such a massive disruption in programs and services in, of course, across our city, but in particular in our part of the city. I can tell you that increase in the number of overdoses that occurred is correlated to a fairly sharp decrease in the number of people who are coming to access our consumption and treatment services.
Do you think that the isolation associated with the pandemic has contributed to an increase in overdoses? Why not?
It absolutely has, and you will. I've seen further studies, and we are part of a response in building in harm reduction related overdose prevention related services and programs into the isolation sites. We know that substance use and drug use is not only an individual behavior problem, it is a societal issue. There are many social determinants of that govern how the patterns of substance use occur in our society, and so I have fairly strong conviction that the isolation has certainly further exacerbated the opioid poisoning crisis that we've been facing in our city for the last several years.
What other policies do you believe need to be implemented to reduce overdoses?
So what I will say is this program that we've been running, and there's a parallel program that's also operating on the west end of the city that's hosted and supported by the Queen West Parkdale Community Health Center, are really the very first pilot programs to be introduced in the city of Toronto to provide an alternate and safe supply of opioids in order that people who have that dependency don't have to risk their lives. This is really the issue that's been fueling the overdoses over the past few years, is that the drug supply is toxic. It is now toxic, and it's toxic because of how and where those substances are being manufactured in the black market, and that's why we have, as a harm reduction approach, developed this program where we can offer a safe supply of opioids to people who have that dependency, and build in more supports, establish relationships of trust, and ensure that people have all of the supports necessary to begin that process to improve their lives, improve the quality of their lives, and to reduce the risk to their health and to the risk of everybody else's health.
What are your thoughts on decriminalizing drugs for personal possession?
It's a really good question, and I will say that for sure the evidence is clear from a community health perspective, from a harm reduction perspective, from an economic perspective, from a societal perspective, that we really have not seen any benefit from the criminalization of these activities. These are, in many cases, health issues, individual health, community health issues, and so we don't see any benefits in criminalizing. Harm reduction alternatives is one that's a little bit more pragmatic, to say, while we're still trying to, let's be clear about what we're trying to do. If we're really trying to assist each other and create health in our community, let's build relationships. Let's not put the actual use of the substance as the first step. Let's begin a relationship. Let's understand one another. Let's provide these other supports and reduce the crisis in that person's life. If for someone who, for example, is struggling with a mental health issue, is currently homeless, and is using substances, we would focus on building a relationship of trust, in being able to have that person come and access mental health services, that person to get housed, and to have some stable food security, and a sense of belonging. And I think these are the things that really can contribute to a higher success in then working through the substance use issues. So harm reduction says we're going to approach this from a human perspective and not focus on the behavior. That's one. And the second big principle for harm reduction is ultimately, unless the user themselves is on board and is choosing to make decisions for their own life, the notion of trying to enforce or impose a set of regulations on that person's behavior have proven to be futile. They're counterproductive to the system and to society, and they're certainly counterproductive to that individual's recovery and health.
Okay, thank you so much for your time. I appreciate it.
All right, happy to talk to you more on the subject. I thank you for your time and for this opportunity to offer a little bit more information about harm reduction.
That was Paulos Gebreyesus, the Executive Director of the Regent Park Community Health Center. Gebreyesus said he is hopeful these projects will reduce overdoses in Regent Park. For Radio Regent, I'm Jonathan Bradley.